Hello, today is Tuesday, May 12th, and we are encouraged by the decline in COVID patients in the hospital. Once again, I want to remind everyone that it is safe to come to Silver Cross. Please don't delay needed medical care or allow your condition to worsen. And not only is it safe in the hospital, we also have safe food practices in place. So with me today is Joey Hummel, a nutrition services aide who delivers patient trays, and Alan Meacham, who is a staff cook here at Silver Cross. So, okay to take off our masks? All righty. So Joey, let's start with you. How long have you been at Silver Cross?
I've been working at Silver Cross for about 3 years now. It'll be 3 years in August.
And your role is to deliver patient trays, is
Correct.
that right?
Yes.
So what's involved in that when you walk into a patient's room?
Well, usually when I walk in, the patients usually say I'm their favorite person they see during the day, I think just because they're hungry. But mostly I'll set up their tray, make sure everything's perfect for them, make sure if they need anything opened, just making sure everything's perfect for the patient, make sure they're happy.
Which is such an important part of patient care. So I bet sometimes they might ask you if they have other needs or things that...
Yeah, their water, if they need the blinds or something, anything around their room, they'll ask me, and I don't mind doing, just as long as they're happy.
And I'm sure your smile brightens their
Yeah.
day. I'm sure it is. So during this COVID crisis that we're having, have you gone into patient rooms, or do you work with the CNAs and nurses to take the trays in?
The nurses and the CNAs have done a phenomenal job. They help out a lot. Obviously, you have Alan that prepares the meals. I'll bring them up, and then they do a big part in wearing their protective gear and whatnot, and bringing in the trays for us. It helps a lot.
It does, and so we have less people going into the room,
Mm-hmm.
so there's not spread of disease. And do you have the protective equipment you need to go on the floors?
Yes, I wear a mask. I wear gloves while picking up the dirty trays. I sanitize my hands before and afterwards. And then even to just be safe, I even wash my hands when I get back down to the kitchen.
Good. You really are a safety champion here. And Alan, let me ask you, what's your favorite meal to cook at Silver Cross?
Oh, there's so many. I really like when we do the Doctor's Quarterly. It gives us a chance to flex our culinary muscles a little bit more than the standardized recipes we follow for patient care.
Sure.
But for patients, I like cooking. It's rare for a hospital. We'll cook a lot of things from scratch. So, like, for instance, our turkey breast, we bring in turkey breast, season them, roast them, get them nice and perfect, hand slice them. Wow. We'll serve them with mashed potatoes that we make. Like, we don't buy, we take potatoes, we boil them up, and we mash them.
Not out of a box.
Not out of a box.
Wow.
We use the homemade gravy. We make it here.
Wow.
We get a lot of orders for that. I mean, I think the patients that are here for extended time, they kind of start to find their favorite meal, and it's usually involves our mashed potatoes and the turkey. The meatloaf we also make in house. They seem to really enjoy that.
Great meatloaf.
I hear a lot of compliments from patients about the meals.
I do too. It comes through in the patient surveys. You just do a great job. How long have you been at Silver?
I've been at Silver Cross for just about 8 months, but I've been cooking professionally for 18 years.
Where did you get your training, your culinary training?
I got my culinary training from the Cooking and Hospitality Institute of Chicago / the Cordon Bleu. It kind of switched while I was there. And then I've just been working in restaurants and hotels, moving through the ranks and getting experience in all different types of cuisines and different environments.
Did you ever think you'd end up cooking at a hospital?
I never expected to, but it doesn't shock me that I did end up here. It's a new avenue to do what I love, and it's really nice to do it knowing that patients enjoy what I do. We get letters and stuff from patients. They'll come down, we'll stick them on the window for a little bit, like, oh, patient in this room really liked this, or they ask, next time maybe a little extra peanut butter. Yeah, no problem.
And you mentioned patients order, so it's not like you're just given a meal. You order what you want to eat off a menu.
Right, and that's where I fit in really well here. Is I come from a hotel last, and I worked a lot of the room service for them. And this hospital is different in the way that there's not a meal time. If you're hungry, pick up your phone, call, call a server. They'll take your order and we'll send it up just like room service. It's 5 o'clock dinner time, which has changed a little bit with the COVID units.
Yeah.
Now they still order what they want, but it all goes up at once.
At a certain time.
And at
Yeah.
a certain time on
Right.
disposables.
Yeah.
And in one sanitized cart. So the cart goes up, it's been sanitized, all disposable food items, trays, and that goes to unit, and then you'll take it there, right? And then
Yes.
the nurses will deliver, and the CNAs will deliver off of
Okay.
that.
Yes.
So very, very safe environment.
Very safe.
And I know there's been a lot of changes because of COVID in our dining room. Can you comment on that?
Oh, absolutely. We do when I work out front with the staff and the very limited visitors right now.
Right.
We've removed our salad bar, and there's, to many people's dismays, the salad bar's gone.
I know.
We
Me
just-
too.
we can't have the contact surfaces. There's too many. We've replaced our salad bar with a pop-up market. So maybe you worked late, you're tired. There's milk, butter, eggs, bread, pre-prepared meals with the same mashed potatoes that we use. And, there's pot roast and pastas, and we have frozen pizzas. A lot of people don't know about those.
Oh my goodness. I
But-
didn't know.
yeah.
But I do know about the turkey sauce over pasta. That is so good.
We make that too.
Delicious.
Pizzas, we have
Yeah.
them, but I don't think a lot of people do. Go down, ask for a frozen pizza. We make that too, and then we have an industrial blast freezer. So we'll make it and freeze it. And it freezes like this, and you
it's
just go,
so fresh.
it's a
Almost
large
like from
pizza.
the store.
Yeah.
Wow.
Except we make
Even
it
better,
here.
probably.
Cheese, sausage, pepperoni.
That's fantastic. So the creativity that both of you have brought forward during COVID-19 has really helped patients. It's helped our team, our staff here, physicians here. Everyone's really, really appreciative of your hard work and your efforts, and making sure we get through this period as safely as possible. Joey, anything you want to say to your colleagues?
I'm just hoping that this is all ending soon and
Yeah,
everything
me
goes back to
too.
normal.
Yeah. Well, thank you. Thank you for
Thank
all
you.
your hard work. And how about you, Alan? Anything you want to say?
I just want to say we've always been really good with sanitation downstairs. And there's little champions of a kitchen. They're little red buckets, and you might get a glimpse of them from time to time now, but they're full of sanitation water, and we just wipe everything after we use it. I would ask if everybody, we don't really like wearing the mask, but we do it. If everyone could just leave it on when you're ordering out front and paying,
Yeah.
and then when you sit down, take it off and get that. It's finally off. But just keep it safe through the
Thank you.
cafe.
Thank you for pointing that out, because we want to keep our employees safe and we
Right.
want to keep staff and patients safe.
Yeah.
So thank you both so much. Appreciate you taking the time to talk with me today.
Thank you.
course.
Thank
Thank
you.
you.
Thank you.